Hello and welcome to another edition of the Ask Dr. Pickel show, where we try to find answers for people with chronic health problems, chronic conditions. And I'm Dr. Jason Pickel. I practice, I'm a board certified functional neurologist, chiropractic neurologist, and I also practice functional medicine. All right, so today, interesting stuff here. We are going to talk about leaky gut and blood sugar issues. So kind of interesting. We're going to kind of look at the most cutting edge stuff here. You know, the information, we always try to stay up to date with our information and the research. And that's what actually helps us to get the best results, because as long as we stay up to date, this really helps things, because I find that a lot of treatment methods can be very outdated. There's kind of old school nutritional thoughts, old school alternative medicine, things like that. But again, we've got to kind of rise up and always be looking for the latest information, the latest research, looking for information that helps people get further than they have in the past. So, all right, so today we'll just dive right in with this and let's go. All right. That on there. Okay, so leaky gut, and you've probably heard of leaky gut. Or another word for this is increased intestinal permeability. You don't have to remember that. But leaky gut, you know, is kind of a general term. It's kind of a buzzword you hear about now. And it has some varying meanings, but a lot of it has to do with the immune system in your gut wall, and your ability to absorb things properly. And there's a lot of things that can affect this ability of that lining of the gut. The lining of your gut is pretty important. Now, number one, our gut contains a big portion of our nervous system, second to the brain. It contains a big part of our immune system, 75% of our entire immune system. And of course, the gut helps us to absorb nutrients and break down foods. And I mean, just so many things. And within our gut lives many bacteria. Actually, a lot of bacteria. So we need these guys to help break down foods. They actually manufacture things for us too. There's kind of a relationship we have with these good bacteria. And of course, there can be some bad bacteria. There can be other organisms in our gut too. All kinds of stuff going on there. It's this whole world that lives inside of us that we never really see or totally understand. And even in the research, is not totally understood completely. So again, when we see this leaky gut scenario, we got to say, why is this occurring and how can it affect things? Now, today we're going to talk more about how it affects blood sugar issues. And blood sugar issues can range from things like diabetes, or high blood sugar or pre-diabetes, in other words, insulin resistance, metabolic syndrome, and also to the other end of the spectrum, hypoglycemia or low blood sugar. So if you have any of these issues, this video is important for you, definitely, because in order to overcome these things, these are some factors that you'll have to take care of. All right. So let's dive right in with this. So one thing that can happen is if you get this leaky gut issue, this can start to cause an increased amount of toxins in the gut or in your bloodstream, actually. Let's put it that way. So, and this, when we start to get these increased toxins inside of us because they're getting through our gut and our immune system isn't taking care of business, we get what are called endotoxins. Actually, if it's enough, there's a condition called endotoxemia, but these endotoxins can start to come in. Not good, because then we have these toxins flow. And really what a lot of these toxins are, they're bacteria, or they are these things that are called lipopolysaccharides. You don't have to remember that, but think about, like, even if you kill a bacteria, there's still its skeleton. Not really a skeleton, it's its cell wall, but this is what's called a lipopolysaccharide. And these things they can activate our immune system just as much as a live bacteria. So it's very interesting. Even if you cook this stuff, all kinds of stuff, these lipopolysaccharides just they're always around. Let's put it that way. And if you get enough of them, this will create some problems in your system. Now, another thing that'll occur then is we will get some dysbiosis. And what does that mean? So dys meaning like a malfunction, biosis, this is our biome, this is our gut bacteria. So we start to get abnormal gut bacteria living in our gut, stuff that shouldn't be in our gut, or amounts of bacteria that shouldn't be in our gut, that should be down to certain levels. So we can have all kinds of trouble from this too, because we don't want too much of the wrong bacteria, or even too much of what is potentially a good bacteria can be a problem. So we want to get these things under control too. But again, these are all being driven or pushed by certain things that we're going to talk about, and also will create problems. Now, let's one thing that can happen here with all of this, in fact, we'll just kind of move down here because we're going to put it all together here. When we start to have a lot of problems, when we start to have blood sugar problems, one thing that we have to look at is the pancreas. So this pancreas lives in your gut, kind of by your stomach, more towards the center of your abdomen. And the pancreas has these cells in it. They're called islet cells. Islet like an island, little islands, these little cells that are kind of like islands, and they make insulin. So let's put pancreas, islet cells. All right. And whoa. All right. Okay. So we've got those. Now, what can happen here? So one thing that can start to happen is if we get these endotoxins here, this is going to activate an immune system factor. And it's called TL4. You don't have to remember that. But what that's going to do is that's going to suddenly increase inflammation, not only potentially of the gut or anything else in the body, but especially of the pancreas. And then we get decreased insulin responses. So if you get decreased insulin responses, what's happening? Now you can't taxi cab your blood sugar to your cells, and this is going to start to cause fluctuations in your blood sugar. Not a good thing. You can get highs and lows, get a lot of lows, you could even get a lot of spikes. So this will start to cause problems, and sometimes your doctor may diagnose you with a diabetic issue, a blood sugar issue, and it can be caused by a lot of this stuff rather than other things. But again, we'll kind of get to what's driving some of this here in a minute. Now, so that's one factor with these endotoxins. They're going to really kind of pour gas on the fire and just create a lot of inflammation. Now, the other side, this dysbiosis side, yeah, this is going to be a problem because this is going to do a few different things here. That's going to start to affect, well, in fact, let's drive it up this way first. One thing that it's going to affect is the dysbiosis is going to start to drive gallbladder problems. So this gallbladder, we'll just put dysfunction here. So gallbladder dysfunction, that could be like gallstones, sludge in the gallbladder. So the thing is, you know, when you have a gallbladder issue, or even if they remove your gallbladder, they never tell you why it occurred. Why did you have to remove my gallbladder, doctor? What was going on? Well, you had stones. Well, you had sludge. Well, your gallbladder wasn't working. Why? Why wasn't it working? Is this just something that commonly happens to people for no reason whatsoever? No, there's always a cause for every effect. So we've got to always ask why, because even if they remove that gallbladder, that means the problem is still going. They didn't eliminate the cause that occurred in the first place that led to that. And is it causing other problems too? So you got to kind of think that way. Start to think cause. So the problem is if this dysbiosis is causing gallbladder dysfunction, further gallbladder dysfunction will lead right back to even worsening dysbiosis, which is not good. Now, also, if we have this dysbiosis occurring with this going on, this is going to alter bile acid metabolism. Now these bile acids, remember, that's what our gallbladder releases. It releases bile, and bile helps to break down fats and oils. Actually, bile does other things too. It actually comes over here. We need it working because it comes over here and it stimulates more insulin responses. So we need it to work properly. Now, the thing is, yeah, you never knew your gallbladder affected your blood sugar, did you? All right. Yeah, especially at the pancreas level and your ability to make insulin. So the thing is this can alter, it's called FXR, but it can alter these FXR responses, which can affect your ability to metabolize these bile acids. All right. Now, another thing that'll occur too, which I was kind of at just a second ago with these bile acids, is this dysbiosis. This will actually cause some other things called GIP and GLP to both decrease. And this isn't good because this again is going to affect these islet cells and their ability to make insulin. So again, a lot of things happening here that are just affecting your insulin levels, affecting the ability of your body to taxi cab blood sugar to your cells. Now, if this pancreas is having problems here, one thing that's going to occur is this is going to alter what's called glucagon. Your pancreas makes what's called glucagon. This helps with blood sugar responses. So again, if you aren't making glucagon properly, you're going to get low blood sugar, which is also known as hypoglycemia. Now the thing is hypoglycemia often not diagnosed until a blood sugar on a blood panel drops below like 65. But that's when people are passing out. That's when you have severe symptoms. Actually, from a functional standpoint, we don't like to see your blood sugar below an 85. Yeah, that's a big difference. So again, if you start to drop below an 85, you're already creeping into lower blood sugar. And again, if your pancreatic islet cells are not, or if your pancreas isn't making glucagon properly or giving you an altered response to glucagon, then your blood sugar is going to drop. Now, another thing's going to happen over here too, and this is going to be dysfunction of what are called beta cells. These are some cells in your pancreas also, and of course, this is going to be the manufacturing of insulin too. And again, this will cause more of a dysglycemia, let's put it that way, or dysinsulinism is the better word there. So dysinsulinism, what's that mean? That means malfunctioning insulin production. And what's that going to do? It's going to cause dysglycemia. It's going to cause blood sugar fluctuations. This could cause high blood sugar or low. So this can make your blood sugar go up and down like a roller coaster. It could cause insulin surges, which shoot it up high. It could cause where all of a sudden we get a low function and then it drops real low. So you can get either one of these. All these fluctuations being caused or created by this. So then we've got to say, hey, wait a second. What's driving a lot of this problem? What's really occurring here that's creating so much trouble and causing this leaky gut that's kind of starting a lot of this off, and what can we do about it? Well, one thing that's really important and really crucial to help this out is we need fiber in our diet. So if fiber is low, then we'll get a decrease in what are called short chain fatty acids. So if you're not eating much fiber in your diet, and you can look up fiber and what's fiber's in, it's in a lot of stuff, but we need it. This will decrease what are called short chain fatty acids. Now what happens is fiber goes into your gut and your bacteria in your gut ferment that fiber. it's kind of an odd process. It's kind of neat how it works. And these gut bacteria turn that fermented fiber into short chain fatty acids. Yeah. I mean, you can actually find things that are high in short chain fatty acids and take these or eat these, but your gut manufactures this stuff. So, but it has to have fiber to do it. So again, these short chain fatty acids are very important. We want to increase them because they actually will go down and help with the insulin response. This will actually help produce better amounts of it. It'll help those islet cells, this pancreas, to work properly. So yeah, one of the reasons fiber has such an important effect on your blood sugar. All right, so we want to increase fiber. So definitely increase. Let's change that. Put a green one there. All right. The other thing here too, that's going to be a factor is an inflammatory diet. If your diet's inflammatory, if you're eating a lot of foods that you already know are problems, yeah, this is going to lead to leaky gut. Now, also, if you have food sensitivities, yeah, there's leaky gut also. Food sensitivity is a little different. Food intolerances, food sensitivities, very similar. Not food allergies. Now, food allergies, of course, are going to cause damage, but that's going to be a different side of your immune system that responds to that. And that's where if you eat like some peanuts, you can end up in the hospital. Now, food sensitivities, these would be things more like proteins that are in gluten, dairy, soy. You know, it's like, hey, I eat this food and I get bloated, or I eat this food and I get diarrhea not too long after, or it creates other brain fog, headaches, things like that. Food sensitivities, food intolerances. Same thing, inflammatory diet. This is going to affect that leaky gut, cause it to be inflamed. What's another thing that does this? Alcohol. Alcohol leads to leaky gut. Yeah, this is not good for that good gut lining. Not good for what's going on there. And another one that's hard to avoid, processed foods. These also lead to this leaky gut scenario. We need these whole foods. We need these good foods. So these can create problems. Now, what's another factor that comes into play here? Let's say we eat a lot of fried foods. Yummy, right? All right. So fried foods, you know, some people say, gosh, every time I eat fried foods, yeah, it really messes me up. I get a stomach ache, or I get a diarrhea, or I get problems. Well, this is going to affect a couple of things. Number one, these fried foods, yeah, it's going to put a lot more pressure on your gallbladder that right now, because of your current dysbiosis, is already malfunctioning. And now you're wanting your gallbladder to make more bile to help break down the fats from the fried foods, which are pro-inflammatory fats. So you're just making the whole situation worse for your gallbladder, which can lead to gallbladder problems, maybe even surgery, things like that. And then the fried foods are also going to fit into dysbiosis. So the fried foods are going to mess up your good gut bacteria balances, cause populations of the wrong bacteria or other bacteria to grow abnormally. So again, fried foods, it's going to be trouble. Or also, sometimes a high fat diet. Now, high fat diet isn't really going to be a problem unless it's all pro-inflammatory fats. You know, if you're eating a lot of oils that have been cooked at high temperatures, yeah, that's going to be a problem because those oils turn and change and now they become inflammatory. But if you have a healthy high fat diet, that can be really good for you. You hear of people being like on a ketogenic diet, great for you. But at the same time, if you're eating a high fat diet and you have a malfunctioning gallbladder, it's not going to work out very well because you can't break down those fats and oils, and it's just going to make you feel lousy and cause all kinds of problems. So sometimes you have to resolve that first. The thing is, though, is these bad guys up here are, well, actually not bad guys. Let's put if it's low fiber inflammatory diet, food sensitivities, alcohol, food, processed foods, fried foods. These are all driving your leaky gut issue. And if you have a blood sugar issue, if you have diabetes, if you have hypoglycemia, prediabetes, dysglycemia, metabolic syndrome, insulin resistance, you may have had many of these diagnoses. You've got to watch this stuff. You've got to change your diet. If you can't change your diet, you can't overcome this stuff. But if you change your diet, you can change a ton of this stuff. You can actually, it's amazing the pressure you can take off your pancreas. It's often that, let's say a person has diabetes and they'll put them on medications which increase insulin production at a higher level to try to get that blood sugar going into the cells more. And if you have diabetes and you're on these medications, you know what I'm talking about. Now, the problem is this forces that pancreas to work harder and harder and harder. And eventually you can say to the doctor, hey, what happens if my pancreas gives out from being overworked? And the doctor will say, well, that's not a problem. After that, we'll just inject insulin. Well, insulin's pro-inflammatory, and create all kinds of other problems. And once you get on that diabetes bus, you just keep going down the road. So you've got to find a way off the bus to get yourself better despite the road that's been chosen for you, I guess you could say, sometimes by your well-meaning but uninformed doctor. So we've got to look at these other roads, these other avenues, and diet plays such a big part. And today was just to kind of show you how that plays a big part, and hopefully that helps and gives you some good information. All right, so everybody have a wonderful day, and I hope you enjoyed this, and God bless, and I'll talk to you next time.